Here's something that most women do not talk about, but almost all experience: vaginal discharge. So, if you've ever wondered whether the discharge that you're having is normal or abnormal, or you should be concerned, you're in the right place. Hi everyone, I'm Dr. Peter Aziz. I'm a urogynecologist and pelvic surgeon. Today I'm going to be breaking down everything you need to know about vaginal discharge. By the end of the video, you'll understand what's normal, what's not, when exactly you need to see a doctor. So let's dive into it. So let's start with just a simple explanation. Vaginal discharge is completely normal. Vagina likes to clean itself. The discharge part is natural cleaning process. It's made out of fluids from the cervix, the vaginal walls, some dead cells that the body's shedding, some bacteria that are dead. Fluid keeps important purposes. Number one, keeps the vagina clean. Number two, maintains a healthy pH. Number three, provides lubrication. And number four, prevents infection. So what does normal discharge look like? It can vary quite a bit from one person to the other, even throughout your menstrual cycle. But here are the general characteristics. Color is clear, white, slightly off-white. It may look a little bit yellowish when it dries off on the underwear. That's totally fine. Consistency. It can range from thin and watery to thick and sticky, depending on where you are in your cycle. Like around ovulation, you might notice it becomes clear and stretchy. After ovulation, becomes thicker and more opaque. The amount also varies from one person to the other. Some women, they have a little bit, others, they have a lot. Both are normal as long as it doesn't change dramatically. Also, the odor. Normal discharge has a mild smell that it's not unpleasant. It might smell a little bit more depending on where you are in your period as well. The key thing is normal discharge shouldn't cause itching, burning, pain, irritation, or any other symptoms. So when is it a problem? So discharge becomes abnormal. There are specific changes that signal something needs medical attention. So you should be concerned if you notice these things. Sudden increase in the amount, the color, especially if it's gray, green, if it's fishy odor or foul smelling, change in the consistency like frothy or cottage cheese. If you have pain, itching, burning, discomfort when urination, pain with intercourse, that probably indicates that there is an infection going on or maybe something else. So let me explain what's happening at this point. The most common cause of abnormal vaginal discharge is BV or bacterial vaginosis. There is pretty much an imbalance between the normal bacteria and the vagina, which is called the lactobacilli, likes to keep everything balanced. When the lactobacilli decrease, the other bacteria, they overgrow, you get BV. Discharge typically looks grayish-white, thin, distinctive fishy odor, and the odor becomes stronger sometimes after intercourse or during your period. Keep in mind, this is not a sexually transmitted infection. It is not transmitted sexually. However, having new or multiple sexual partners can be a risk factor for getting BV. Also, using like harsh soaps or things can disrupt the vaginal pH. It's pretty easy to diagnose. Doctor basically takes a little swab, gets a sample of the discharge, check under the microscope, check the pH, easily treated with antibiotics like metronidazole. There are pills, there are creams that you can take. Make sure you complete the course of antibiotics. Don't take a little bit and then you stop. Also, please, if you are going to take the pills, do not drink alcohol with the flagyl or metronidazole because they interact and the side effects are really bad. The second most common cause of vaginal discharge is yeast infection. That's overgrowth by a fungus called candida or yeast. It naturally lives in the vagina in small amounts. However, when they start multiplying a little bit, you get an infection. What is the hallmark symptom? Thick, whitish discharge that looks like cottage cheese. However, not everyone has this classic appearance. Some women have more of a watery discharge. However, even if the discharge itself doesn't smell, but you will have intense itching and irritation of the vagina and the vulva on the outside. You have redness, swelling, burning. Please don't scratch it because of the irritation, because it's going to make it worse. Risk factors: taking antibiotics that can kill off the good bacteria. If you have diabetes, if you're pregnant, or weakened immune system, Also, if you're using like scented vaginal products. Again, it's very easy to diagnose, like literally, if you get a pelvic exam and the doctor puts a speculum in, once you see the discharge, you would know exactly that it's yeast. Mild infections can be treated with over-the-counter creams. There are some pills that you can take as well. They're prescription pills or also prescription creams. Usually goes away pretty fast. The third most common one is called trich or trichomonas. That's an infection caused by a parasite. It's less common than BV and yeast, but it's important because it is a sexually transmitted infection. And if you have it, both you and your sexual partners need to be treated. It looks like yellow-green frothy discharge that has a foul odor, but also some women, they don't have symptoms at all. When you do have the symptoms, itching, burning, redness, discomfort with urination, with the intercourse. As you can see, these symptoms can overlap between one condition to the other. This is why it's important to see a provider to get a proper diagnosis and get the right treatment. Again, treatment for trich is very easy. Antibiotics, make sure you finish the pills. Also, your partner has to be treated, otherwise you will get reinfected. There are some other causes, but not as common, like cervicitis or inflammation of the cervix, caused by other sexually transmitted infections like chlamydia or gonorrhea, pelvic inflammatory disease, when the infection starts spreading to the uterus and tubes. That's more severe and requires immediate attention. If you have like allergic reactions or irritation from soaps, detergents, some condoms as well. Menopause, birth control, pregnancy can also affect your discharge. In rare cases, especially if you're after menopause, if you have a bloody discharge, that is serious and can be a sign of cancer. You should always get that evaluated if you ever had that bloody discharge. So those are the most common causes, like understanding basically what the discharge is. It's part of knowing your body and maintaining your health. Remember, there's normal discharge and abnormal. So just pay attention. If you have something, don't ignore it. Don't feel embarrassed. Talk to the provider. They're there every day to help you out. Thanks for watching this video. If you find it helpful, please like and subscribe to my channel. Drop any questions in the comments below. I'll do my best to address them in the future. I'm Dr. Peter Aziz.